So, hello, ladies. So plastic surgery, but mainly tummy tucks I feel like they're definitely going to be more popular than they have been in the past few years. And why do I say though? Is because of Ozempic and all these other things that are happening, people are using to lose weight, and that are extremely overweight. So because of that, there's going to be a lot of loose skin and things like that. I think the other term is called angioplasty, tummy tuck. So anyway, I want to actually see this video is pretty much go over. I think there's another video I actually have going over what angioplasty or tummy tuck actually is, because some people are curious about it, if it's a good idea, and all these different things. Because a lot of people losing weight, like I said, with Ozempic and all these other drugs or other means, and what to do with the extra skin. Should I just live with it? It is what it is, or just try to figure things out, getting plastic surgery. All right, so my name is Shane. I'm a personal trainer and nutrition coach. I help busy women simplify health and nutrition so they can make better informed decisions when it comes to their health and fitness. So it's definitely a topic that I have dealt with a lot with my clients, my female clients. So let's see what this doctor has to say about it, what the procedure is.
Hi, everybody. I'm Dr. Peter Felice, and I'm a plastic surgeon at Advanced Cosmetic Surgery. Today, we're going to be talking about recovery for tummy tuck procedures. After tummy tuck surgery, it is absolutely expected and normal for patients to feel uncomfortable and sore. This soreness throughout the abdomen and the upper ribs usually lasts for a few days after the operation before, little by little, it starts going away and you get back to feeling like your normal self. Usually by about a week to 2 weeks, patients are back to most of their daily normal activities without the discomfort slowing them down at all. So you'll do your recovery right here in our surgical suite after your tummy tuck operation, and patients at that point are ready to go home after about an hour or so. Patients really love the fact that they're able to recover in the comfort and familiarity of their own home with no need for an overnight hospitalization stay or a surgical center stay. We perform our abdominoplasty procedures with a muscle plication done at the same time. Basically what happens is with aging or childbirth, the muscles that are in the midline of our abdomen can slowly separate and have what's called a dehiscence. What we do in the operating room is we actually take those muscles and bring them back together in the position of the middle of the abdomen to form a nice, tight, compact repair that gives a wonderful aesthetic result without losing or compromising any of the functional component of the.
Yeah, so I've seen women that have that, and men too, but mostly women. And it's like aesthetically, it is probably not appealing. Than having like the six pack or whatever that you want, the flat stomach, you have that like that indent. But from what I understand, you can actually make things happen and actually work through it. Not work through it, but strengthen it, and it kind of can like not fix itself, but to a certain extent. But doing like certain like planks and stuff like that, ab strengthening exercises can actually help. What is it called? Vacuum, the stomach vacuums. When you're sucking your stomach in, pulling your belly button into your spine and holding it, and it actually helps focus more on the transverse abdominis, and it's like your natural human corset. Corset, your natural corset, and it kind of tightens that up, and that helps that.
The muscles themselves. We use a combination of both dissolving and permanent sutures for your abdominoplasty procedure. So there will be some stitches that we take out for you after about a week, but the rest dissolve all on their own. So after your tummy tuck procedure, you will be fitted for a custom compression garment that we'd like you to wear for about 3 or 4 weeks after the operation, just depending on your recovery process. The reason why we want you to have this garment is so that it can nicely compress and help shape the final result, and also decrease the buildup of any postoperative fluid that normally occurs after an abdominoplasty procedure. The final result of all of that is to give you a nice, sleek, shapely result that's going to look fantastic. You will be up and walking the same day as your tummy tuck procedure. In fact, the more, the better. We love it that our patients are up and walking around to help get the blood flowing and actually increase the healing at the rate of the surgical site. And patients overall feel much better the sooner that they're back on their feet.
Control though. You don't want to do too much too fast. You just control that.
Again, you'll gradually increase your level of activity, both for physical activity, work, and leisure activity throughout the next couple of weeks of your recovery period. And normally by a month out from the operation, you're doing whatever it is that you'd like to be doing. There are lots of different things that patients can do to prepare for the recovery period after their tummy tuck procedure. One of the things that we like our patients to do is to sleep propped up and a little bit inclined with some pillows or with their head elevated against the backboard of their bed. This helps to take a little pressure off of their incision site and to help fluid drain a little bit better. And patients say generally they're more comfortable propped up for the first week or so after the procedure. It's also a good idea to make sure that you've made any type of arrangements to be out of work or to have some help with childcare for about the first week or so, just because you're going to want to spend your time recovering and not doing too much heavy lifting. Also, any groceries that need to be bought or any preparations around the house to get it comfy, to make sure that it's going to be a great environment for you to heal in, are also recommended that you do before your procedure. A lot of patients will ask us, well, what happens if I become pregnant or gain or lose weight after their tummy tuck procedure? And the standard answer is, well, let's see on a case-by-case basis. It is possible that with expanding the stomach again with pregnancy, there can be some loose soft tissue and loose skin that can be excised after childbirth if that's what the patient decides to do. The same is true for any weight loss or weight gain. There can always be changes in the character, the tightness of the skin and the soft tissue that we may need to do a little touch-up or a revision procedure for. But whatever the change is, that's something that we're always open and happy to talk to our patients about to make sure that your results are terrific, not just in the short term, but for the long term and for the rest of your life.
So these questions that he answered, well, were actually very, 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 very important. It's actually really interesting because I wouldn't even thought about some of the ones that he was asking about being pregnant again and stuff like that. That's actually interesting. So I think the next video actually goes over what it actually looks like. But I do know one of my clients, she lost a ton of weight and she ended up needing to, she wanted to get her stomach done, her legs done, and her arms done. You know, so I know tummy tucks is usually, you know, I mean, they have different names. The angioplasty, I think, is the stomach, and I forgot what the arms and legs are. But yeah, that's interesting. And you know, she's fine now. It took a long recovery. It took a while. I think she did in sections though, because she stopped training with me, and then she got that done. Let's see this.
Did you know a tummy tuck actually involves cutting off excess skin? In this procedure, a surgeon makes an incision from hip to hip, just above your pubic area. Your excess skin is pulled down and tightened, and your belly button is repositioned through a small opening in your newly tightened skin.
Oh my gosh! So that's how they do it. So they cut it, the bikini line, then they stretch it out, and then cut it again. Cut the excess off. Makes sense. I never really thought of how would they actually do it, but that's interesting. Wow. Okay. So they cut it, the bikini line, stretch it all the way out, cut it again, and then wow. Okay.
After your sutures heal, you'll have a thin scar along your bikini line. Did you know a tummy tuck
Yeah, so that is interesting. I hope that helps anyone that actually has questions about tummy tucks and stuff like that. I just didn't think, I mean, it's kind of, that makes sense, but I just didn't think that's how they actually do it. But that's what a tummy tuck is, and that's the previous video before that is what to expect and what, you know, when it comes to getting it done. But that was good. Wow, now I know. I didn't know. At least we learned something both together, hopefully. Anyway, thank you so much for watching me. If you found this helpful, please be sure to share with someone who might need to hear this message. Prioritizing yourself is something you never regret. I'll see you next time.